can't understate the significance of advocacy. The phrase that they use on Capitol Hill is decisions are made by those who show up.
Our objective as a patient advocacy organization, working with our patients, has always been improving the quality of life, and doing that through making sure that our patients get access to and reimbursement for all of the therapies that have been approved since the first one got delivered actually in 2009.
Well, I think it's super important with all rare diseases, but particularly with something like HAE that isn't often talked about, that activism and awareness is raised. And I think obviously talking to legislators, talking to the people who are in charge of shepherding these tax dollars and shepherding the public interest, it's super important that they're aware of HAE and that they support the broader programs like the NIH research funding that not only help HAE patients worldwide, but also sufferers of all sorts of other rare diseases.
The other piece that made the HAEA very special in terms of bringing all of these groups together, again, from the patient's perspective, was the Orphan Drug Act. Now, the Orphan Drug Act was passed to do one thing and one thing only, and that was to make sure that conditions where there were a tiny number of people didn't get swept under the rug and get forgotten.
The HAEA operates what you call a volunteer grassroots network. So there are people all over the country that work together, and this is because there are members of Congress and policymakers from all over the country. So whether you live in Alabama or whether you live in Alaska, you have congressional representatives that are deciding how the healthcare system is going to work and what types of medical research are going to be prioritized. So we make sure we all work together so that they get the same message and they're able to respond in a way that's consistent. No one individual can do it on their own. We amplify our voice by working together.
We all have power as individuals, but when we come together as a community, we harness so much more power.
It's just awesome to see someone as young as him just take it head on and advocate for himself and all of the friends that he's met and all of the friends that I've met. It's just been life-changing.
I mean, everybody can have more of an impact with the HAEA by just getting involved. We have advocates, we have people that are kind of the patient representatives. All of those things are important, and then once you get home, you have to continue to push. You have to write your congressman, you have to write your senator, and make sure that they understand that we are an integral part of their community.
This is absolutely a second family to us. Finding the people here and each event that we go to, we continue to meet more parents, more children, whether they're Luke's age, younger, older. Every event we go to, we find somebody to connect with.